Hi, my name is Dr. John Runback for American Endovascular and Amputation Prevention. It's my pleasure today to share a case of pedal arch reconstruction in our office-based laboratory in New Jersey. This patient was a 92-year-old woman, but very energetic and very interactive, who had a painful digital ulceration as well as focal gangrene in her left foot, despite having recently had FEMOROPOPLITEAL angioplasty or balloon procedure performed outside. You can see the wounds on this picture here, which are these patchy areas of gangrene. She was older. She had hypertension, dyslipidemia as risk factors, but did not have diabetes, coronary artery disease, problems with the kidney function, or any history of smoking. These are the results of an arterial ultrasound, duplex arterial ultrasound, and these monophasic and absent waveforms refer to areas where the arteries are blocked entirely or very narrowed. And this is from the popliteal, which is at the level of the knee, into all of the arteries below the knee down to the foot. There are normally 3 arteries below the knee that supply blood flow into the ankle and foot. And in this case, all 3 of those were completely occluded. Our plan, based upon her presentation, her level of pain, the presence of wounds, which posed a threat to her leg and a possible risk of amputation, was to go ahead and restore blood flow down into the foot to get straight line flow and perfusion to the painful ischemic and early gangrenous changes in her toes. Certainly that's what we planned on doing. And you can see here, this is the results of the procedure where we went down and we did intervention for extensive occlusive disease with extensive calcification with a remarkable result and restored flow through the foot and directly to the patient's wound. Let's take a look at, see what that looks like. Here's the angiogram after we were at the head. You can see what's unique here is that we were able to target vessels all the way down into the foot. So this is a sideways view of the foot. This is the bottom of the foot. Here the catheter is coming through the top of the foot. And this is that arch. And off of this arch, these little arteries which go forward, the arteries are directly to the patient's wounds to allow those to heal. One unique advantage we have here at American Endovascular in amputation prevention is a tool set and experience to treat these very small arteries, not just below the knee and between the knee and the ankle, but even treating the arteries into the foot when other doctors may not do so to restore blood flow directly to patient's wound and allow healing. And this is very early follow-up. You can see this is the initial picture, and at early follow-up, you can see already the skin is pinker. She's got better blood flow, a little residual wound here. The other wounds are already healing. The scab has fallen off, and she no longer has any pain. In this particular case, the ability to resolve and treat those very small arteries in the foot, or plantar pedal loop reconstruction and revascularization, was the difference maker for this patient, allowing her to be symptom